Good morning, dear students. How are you all? I know you're very busy preparing for your midterm exam this week. Don't worry, you'll be able to do it well because you are preparing well. Anyway, this portion is not there for midterm, it will be there for the final exam. So, we will be seeing about a new topic today, which is oxygenation. We know that oxygen is the basic need of uh, any living organism in this world. Yeah, be it be human beings or animals or plants, everywhere we find that oxygen is an important part. And especially we know that oxygen is a colorless gas which is present in the air, and 21 percentage of the atmospheric air is made up of oxygen. These are all the facts which you know, and you have learned so much about respiratory system in anatomy and physiology. So you should be able to comprehend and understand this topic very easily. Okay. So we will be learning about the process of breathing and the factors influencing respiratory function, and major type of diseases or conditions which affect the respiratory function, and what is the therapeutic approach we go along with it, and what is the outcome we expected. Okay. As we know that the life depends upon a constant supply of oxygen, and 21 percentage of Earth's atmosphere is made up of oxygen, and each cell of the human body, okay, uses oxygen to metabolize nutrients and produce energy. Without oxygen, the cell dies, especially the cell brain cells. They cannot live without oxygen and glucose. This demand for oxygen is met by the function of respiratory and cardiovascular systems, also known as cardiopulmonary system. So, we need to have our hematologic, cardiovascular system and respiratory system intact for us to have this function going on properly. And oxygenation of body tissues depend on the integrity of the uh, uh, respiratory system to transport air to and from the lungs. Okay, so we see in that upper picture, yeah, oxygen is inhaled and carbon dioxide is sent out, and this process should go on continuously. A properly functioning alveolar system in the lungs. Okay, it is very important because that is the place, alveoli is the place where there is diffusion or exchange of gases which are taking place. Okay, when we come to the structure of respiratory system, you all know very well about this. It is made up of upper respiratory tract and lower respiratory tract, and the upper respiratory tract has it starts from the nasal cavity up to larynx. Okay, then lower respiratory tract from the just below the larynx, trachea, then bronchi, bronchioles, and alveoli it ends with. Now, what is the major role of upper respiratory tract? Okay, we have some small hairs which are present in the nerves inside the nose. They help in filtering the dust and pathogens to some extent. Then once it comes to the pharynx, it is the lymphoid tissue uh, which is present over there in the throat area. We know that tonsils, adenoids and all are present. They trap and destroys the bacteria. Okay, then when we think about larynx, the main thing what we remember is it is preventing the when you're breathing, it's allowing the air to enter, and with the help of epiglottis, when we are eating, it's protecting the airway from getting the liquids or the food particles which we are eating. So, and when we come down to bronchi, we know that we have three lobes on the right side and two lobes on the left side. We have bronchi and small branches called bronchioles, and each bronchioles are like we have something called primary bronchioles, terminal bronchioles, and respiratory bronchioles. Respiratory bronchioles are the ones which have alveoli in them, and a lot of blood vessels are surrounding them. This is where the exchange of gases takes place. Okay, now when we come to this physiology a little bit, there are four mechanisms whenever we think about the respiratory functions. The first mechanism is the pulmonary ventilation, which we are very clear because this is breathing. We call it as breathing. There is movement of air between the atmosphere and alveoli of lungs when inhaling and exhaling. So when you are inhaling, you are taking in oxygen, and when you are exhaling out, we are sending out the carbon dioxide. Okay, and what is the second step? Second step is the gas exchange. The air which we have inhaled, when it reaches the alveoli, the capillaries which are surrounding them will take those oxygen, and they will release carbon dioxide from the veins, and that is exhaled out. Okay, so that is gas exchange. Gas exchange is movement of oxygen and carbon dioxide between alveoli and pulmonary capillaries. Okay, and the third step is the very important step, which is transport of oxygen from the lungs to the tissues. Okay, now which is the one which is transporting oxygen from the blood to the tissues? Okay, it is hemoglobin, as all of you know. Red blood cells, or erythrocytes we call it, they have a lot of hemoglobin, and hemoglobin is the one which is carrying these oxygen to the tissues, and once they release oxygen into the tissue, they take up the carbon dioxide which is produced in the tissue, and they bring it back to the alveoli, so that carbon dioxide is exhaled out. Okay, we know about this process. And the fourth step is the systematic diffusion. When it reaches to the cell and tissue level, what is happening? Okay, so we are breathing, there is gas exchange at alveolar level, then there is transport of oxygen and carbon dioxide through hemoglobin, and the last step is how it is given to the tissues. Okay, some of the definitions I feel it will be good if you can remember. So oxygenation, mechanisms that facilitate or impair body's ability to supply oxygen to the cells. Okay, oxygenation is nothing but how much of oxygen is either supplied to the cells or not supplied to the cells. We are going to learn about it. Respiration, we know it is act of breathing, so inhaling and exhaling air. Sorry. Ventilation is actual exchange of oxygen and carbon dioxide. Okay, respiration, ventilation, breathing, all are similar. Respiration is little more higher. Even all the exchange what takes place also, we are talking in respiration. And diffusion, the movement of substance from an area of high concentration to area of low concentration. Okay, so when we are inhaling oxygen at the alveolar level, the oxygen level is high, that's why it is diffusing into hemoglobin. When hemoglobin is coming to alveoli, bringing in lot of carbon dioxide in the hemoglobin, okay, or carbon dioxide which is coming from the venous blood near the alveoli are higher, so it is going back to the lungs. Okay, and the perfusion is continuous supply of oxygen to the cells. Okay, what are some of the factors which are affecting respiratory function? We know the age group. Okay, age is very important because the lungs are gradually expanding by 2 weeks after birth. Okay, and you will see the respiratory rate to be higher in smaller babies, and as the respiratory system is getting matured, we come to that normal breathing respiratory level which you have learnt in vital signs, isn't it? 12 to 20 breaths per minute. Okay, when it becomes when you become old, okay, old age people, the chest wall and the airways become rigid. Okay, so what is happening? They are not able to inhale and exhale like a young person, and the cough reflex and ciliary action. Cilia is the substance which is present in the mucous membrane like a hair. So it moves away all the pathogens and other foreign bodies entering into the respiratory tract. So when they become mucus become dried up and these action are less, they are very prone to get infection. Okay, and the environment. Altitude, heat and cold and air pollution affects oxygenation. You have learnt it in vital signs itself. When we go to higher altitude, the atmospheric oxygen reduces. Because of that, the oxygen demand of the body is more. So our breathing increases, our hemoglobin level goes higher. Okay, those things. And then people who are living in polluted areas where continuous air pollution is there, their respiratory system also gets weakened. Then lifestyle. If you are doing exercise and regular activities, it increases the rate and depth of the respiration, and also it is very good for the body because you are taking in more oxygen and you are sending out more carbon dioxide. Okay, what about the health status? Very commonly we can find many people with respiratory diseases that can affect oxygenation of the blood. Like there is a disease called chronic obstructive pulmonary disease or some pneumonia or even COVID, which is very common now, is affecting the lungs. Okay, it is causing the infection is affecting the lung tissue, and the infection is producing a lot of sputum and secretions which are obstructing the airway. Okay, this is the problem with many of the diseases. And some of the medications, like the drugs which are given for depression, anxiety, and before surgery or during surgery, those drugs which we are giving can decrease the rate and depth of respiration. Okay, you will be learning about it in adult one. The drug which is commonly used for sickle cell disease over here, okay, in Oman, that can cause respiratory depression, morphine. And stress. I think when we have lot of exams coming up, when we have to study more, we are actually worried because there is a lot of stress which is building up inside us that can cause hyperventilation, and oxygen level raises and carbon dioxide level goes down, which can cause lightheadedness, numbness, tingling of fingers, and around the mouth sometimes we feel that there is twitches. Okay, so these are all the common factors which are affecting the respiratory function. Okay, now we'll go on to something. What are the alterations? We saw that there are 4 important functions of respiratory system. So how in all these 4 the problems can occur? So pulmonary ventilation. So there will be some problem with airway problem will be there. Then gas exchange. So in movement of air between the alveoli to the blood. Okay, transport, you know, where it has to be transported to the tissues, and systemic diffusion is where the cells are taking up the oxygen. Okay, we'll see one by one. So alterations in the respiratory function. First one is conditions affecting the airway. Okay, there are see, even a small cold what we get, we feel so sometimes we feel that we are not able to breathe. There are a lot of secretions which are obstructing the airway. So most of the times it is partial obstruction. Okay, so sometimes when children are sleeping, when they have cold and other things, you can hear some snoring sound, okay, when during their sleep, because partially the airway is obstructed. And also if they are choking, for example, all of you are sitting and eating a great feast, and a small bone, fish bone or a chicken bone, it is caught into the airway. Okay, there it is complete obstruction, so the person cannot even talk, can't cough, and there is no chest movement also because he cannot breathe completely. Okay, so children also it happens, they swallow something which is going into the respiratory tract. Okay, so we need to be taking them immediately to the hospital or starting with CPR. There are some techniques, okay, where you have to tap at the back so that the sometimes foreign bodies come out. This is in the upper airway. This is the commonest problem. And when you come to lower airway, when there are like diseases. Pneumonia is the commonest problem, where there is a lot of accumulation of mucus and exudates because of bacteria. There is obstruction. So even some unconscious patient, this is very common, they develop pneumonia. So you will hear sounds like, some of the sounds which you can hear is stridor. It's a high pitch sound. Okay, and you will find that SpO2 is low, and ABG we can check, arterial blood gases will be low. So those conditions should be handled in a different way. We will see. So you can see when edema or swelling of the trachea or airway occur in response to virus, bacteria or other irritant, the airway is further narrowed. Okay, so there is swelling and also production of lot of secretions which are obstructing the airway. Okay, the conditions which are affecting the movement of air. Okay, so we call those, we have learned all these terminologies in vital signs. Just a review. Okay, tachypnea, you know it is increased respiratory rate, so usually fever, metabolic acidosis. When the patient has severe pain, hypoxemia, okay, you will see them breathing faster. Then bradypnea, you know, low, less respiratory rate, less than 10. Apnea, sometimes stoppage, as we saw already, brain injuries or intake of morphine, the drug which can cause sedative effect. Okay, and hypoventilation. Okay, there are some diseases of the respiratory muscles, and or anesthesia when we are giving. All the smooth muscles are relaxed, so they do not contract and expand properly for respiratory movement to take place. And then hyperventilation in case of stress, anxiety, metabolic acidosis of the body. Okay, and chain stroke respiration. Whenever there is drug overdosage or brain injury, the respiration, this pattern of respiration occurs. Okay, it is continuous, hyperventilation. Then you will have apnea, that is no breathing for some time. There is cycle goes like that. Then Biot's respiration is nothing but, it is a shallow breathing, similar to chain stroke breathing, shallow breathing, and interrupted by apnea. Again, there will be apnea. Chain stroke, you will find hypoventilation, apnea. Biots is shallow breaths interrupted by apnea. And what is orthopnea? Orthopnea, when they are sitting in upright position only, they can breathe. When they are lying down, they cannot breathe. And dyspnea, you know, difficulty in breathing. Okay, so when there is alteration in the movement of air, these are all the terminologies which we are using. And what are the conditions affecting the diffusion? We will see at the alveolar level. Okay, alveolar level, we can say that impaired diffusion. Okay, this one terminology which you should understand is called hypoxemia. What is hypoxemia? Decreased amount of oxygen in the blood. Okay, it happens in case of pulmonary edema, which is the very commonest problem in a patients who are bedridden in the hospital. And another problem is atelectasis. What is atelectasis? Atelectasis means collapse of the alveoli. Instead of alveoli being opened, they close. So how do they receive the inspired air? So when they cannot receive the inspired air, okay, oxygen is not taken up by the alveoli, there is no exchange taking place, there is no diffusion taking place at alveolar level, which causes hypoxia. Hypoxia means there is no enough oxygen is not supplied to all the cells of the body. Especially, as I said, brain cannot survive without oxygen and glucose for a longer duration. The patient will have increased restlessness, lightheadedness. This will be early sign. Okay, pulse will be rapid, shallow respiration, rapid respiration, dyspnea will be there, flaring of nares. Their nose nares will be opened extra. Okay, so that they can take in more oxygen. You can see them really suffering. Okay, substernal intercostal retractions are seen in children. Okay, between the ribs, there are smaller muscles. They they are pulled inward so that they can cause good contraction and they can take in more air. These are all the signs of hypoxia in the beginning stages. When it comes to the stage of cyanosis, that is, the patient will start appearing bluish in color. Okay, you will see around the lips, around in the nail beds, instead of pink, you will find bluish discoloration. Okay, the patient becomes fatigued, very tired, lethargic. Okay, and the finger nail beds will be enlarged. Okay, swollen it will be. That's called clubbed fingers. So these are all the problems when they don't get adequate oxygen or when the alveoli is not functioning properly. Okay. The next step will be the transport, isn't it? What are all the problems in the transport? We know that hemoglobin is the one which is carrying oxygen to the tissues. Okay, if there is no RBC is less, if hemoglobin is less, that is what we call it as anemia, isn't it? If there is less hemoglobin, then less oxygen. No hemoglobin, no oxygen. Okay, and we can measure this with the help of pulse oximeter, which you have learnt in vital signs. Okay. So what are the conditions which can affect the transport? It is the congestive heart failure. Okay, the heart muscles cannot contract like before. So that is called heart failure. Okay, so enough cardiac output is not there. When enough cardiac output is not there, the blood does not reach the alveoli or the tissues. So, very little amount of oxygen, whatever is carried by the RBCs only, reach the blood cells, reach the tissues. Another problem is hypovolemia. Okay, maybe the child was having continuous diarrhea and vomiting. Okay, and lost a lot of fluids from the body, dehydrated, or sorry, an adult who had accident, okay, and lost around 2 liters of blood. So such conditions you will find that the transport is affected because you don't have adequate RBCs to carry the oxygen. Okay, now when it comes to some factors which are affecting, or what are all the things you are going to ask the patient when it comes to the health history, what are all the assessment we are going to done on the patient. Okay, what is their usual pattern of respiration? You know to assess the respiration very well now, isn't it? Okay, so whether they have dyspnea or whether they have any allergies or do they have any difficulty in breathing, okay, any medicines they are taking, what about their health history, any heart problem they have, lung problem they have, okay, or any changes they have noticed. Okay, like for example, I'm walking for a short distance, then I feel I cannot breathe anymore, or I'm continuously coughing when I get up in the morning. Okay, some of the changes which has taken place. And lifestyle and environment is very important because we have already seen if they smoke or if they are exposed to a lot of pollutions in the environment, that can also affect their respiratory system. And then about their cough. Okay, why cough is important? Because there is something called which is dry cough. There is no sputum, but there is something called productive cough. What is the meaning of productive cough? It has lot of secretions. What is the color of the secretion? For example, when we know that it is thick and yellow in color, we know it is bacterial infection. Okay, so like that, to identify that, we want to know about the pattern of cough. Then about the sputum, how much it is coming, do they have any pain, then dyspnea, fever do they have, are they feeling very tired, all those things we will be asking. Okay, there is a question over here. A nurse is caring for a patient who has been hospitalized for an acute asthma exacerbation. Acute asthma, all of you know. Okay, it suddenly, because of the climate or something, the breathing difficulty is more. So which testing method might the nurse use to measure patient's oxygen saturation? The clue over here is the oxygen saturation. Okay, we need to measure oxygen saturation, so please find out. And okay, what are some of the nursing diagnoses we can make for this patient? It is the ineffective airway clearance, Why we are saying ineffective airway clearance? Because they have a lot of secretions which are there in the airway. So the air cannot go inside or come out. And then ineffective breathing pattern. When do we say ineffective breathing pattern? When they cannot expand their lung muscles, isn't it? And or some partial obstruction in the bronchus. So they are not able to take in more air or bring out carbon dioxide. Okay, then when do we say impaired gas exchange? At the level of alveoli. If there is some heart failure or pulmonary edema full of fluids, okay, alveoli is filled with fluids, alveoli cannot do the gas exchange properly, so we call it as impaired gas exchange. When do we say activity intolerance? When the oxygen is not reaching the peripheral tissues and cells, okay, the patient cannot do any activity. Yeah, they'll feel very tired with the little activity. So those things. Then anxiety is very important, because when you cannot breathe, especially in case of asthma, when they cannot take breathe, you can see the anxiety in their face. Am I going to die? What is happening to me? We have all such feelings, isn't it? Then fatigue, when we are having chronic breathing difficulty. Okay, uh, really fatigue is the biggest problem, because the cells are not getting adequate oxygen. They become very tired. Then fear, powerlessness, insomnia. Sometimes they are not able to sleep. Some of the diseases are contagious, like COVID and all. They are isolated completely, isn't it? So all these are some of the problems which can occur for these patients. Okay, what is the first thing you do when someone has difficulty in breathing? Okay, this is a very important question. Okay, you will think an answer, but I have the answer. Okay, what are some of the nursing measures? The moment I see a person is not able to breathe properly, what is my first thing? I raise the head end. You know the position, Fowler's position, isn't it? So you raise the head end of the person. How does it help? When you raise the head end of the person, the abdominal muscles or the abdominal contents are not pressing on the diaphragm. Okay, so expansion of lungs become easier. That is the first way. Then you think about coughing and breathing exercises. Okay, we will be teaching exactly how to do this procedure in the laboratory. So you will ask the patient to take deep breathing, and then exhaling out more carbon dioxide, then coughing to remove secretions from the airways. Okay, we will be asking the patient to keep their hands in the abdomen so that they can feel the abdominal movements. You will ask them to take deep breaths, hold it for some time. Okay, breathing through the nose, they remove or they exhale through the mouth. We will teach you in the lab, okay, these breathing exercises. Then at the end of breathing, they have to do a coughing. So the secretions come out very easily. So these exercises will be taught to the patients. And also hydration is very important. Okay, you need to have more fluid intake, better to have some warm fluids and soups, so that the respiratory secretions are liquefied. And we have something called humidifiers. Now many people are taking the what do you call that? They are taking inhalation, isn't it? It's just a steam inhalation. Through a steamer, you take those mist inside this um, respiratory tract. It loosens the secretions and it humidifies mucous membrane so that it is not getting dried up. Okay, and there are a lot of medications. You will be learning about all these medications in detail when you come to adult one. So some of the medications which we use, see, bronchoconstriction is the biggest problem. So most of the drugs which we are using are called bronchodilators. I think during inhalation all of you saw this puff, this inhaler, which you can keep in the mouth of the person and then press it. Okay, so most of these are having bronchodilator medication. It goes directly into the bronchus, so it causes relaxation of those muscles and the patient can breathe easily. Then anti-inflammatory drugs. Okay, as we saw in the previous picture, that the airway gets swollen up, so the space becomes very narrow. So anti-inflammatory drugs will help in decreasing the edema, decreasing the swelling. Okay, and then there are some drugs which are called expectorants. They are given in the form of syrup, cough syrup we call it. Okay, they bring out the secretions which are there inside. And then there is one more drug which is commonly used for asthmatic patients. They are called leukotriene modifiers. Okay, leukotriene is a substance which is present, which can also sometimes cause bronchoconstriction. This is mainly for people who are having COPD or sometimes even allergies. So when leukotriene is modified, that it doesn't cause bronchoconstriction, those drugs are called leukotriene modifiers. Okay, so these are some medications which we use in the form of inhaler or tablet or injection so that the patient feels better. Okay, we have something called incentive spirometry. Incentive means some gift. Okay, so or some reward you are giving. So how this machine is designed is, this is just a small, you would have seen, many of you would have seen in the hospital setting. Just to encourage the patient to do the breathing exercises, we can give this machine, and when they are inhaling, you can see the balls, there are different colored balls which are there inside, they raise up. So the patient is continuously looking at the ball. Okay, I want to breathe nicely, I want to breathe nicely so that I will reach the target. Okay, so by looking at something, they are doing the breathing exercises better. Okay, we will show you in the lab. We have this incentive spirometry. How does it work? We will show you. So it improves the pulmonary ventilation, and this is mainly used for patients after surgery so that the anesthetic gases will be exhaled out faster. And also it loosens the respiratory secretions, it facilitates that air exchange, and even cough helps in bringing out all the secretions. Okay, there are some more techniques which are called percussion, vibration, and postural drainage. Okay, this is usually done for patients who are having uh, severe, pneumonia. Okay, pneumonia patients, they have at the base of the lungs, if there are a lot of secretions which are settled, these are some techniques which are done. Even for COVID-19 patients, they are following all these techniques in the hospital setting. Okay, what is percussion? Like a clap. Okay, how do we clap? But you keep it like this, and over the back and the front portion, we will be giving smaller taps. So it brings out the secretions which are lodged in the bronchial walls or from the base of the lungs. It is able to bring it to the mouth, and they can spit it out. Then vibration is another technique. There are some vibrators, sometimes for massaging they use. So same way, the hands are kept on the patient and you keep shaking it. Okay, so this also helps in bringing out the thick secretions. There is one more technique which is very important. It is called postural drainage. You see in the third picture, the cot itself is positioned in a different way, and the patient also is positioned with lot of pillows and everything on a different way, so that from each lobe of the lungs, the secretions, thick secretions uh, there, will be coming out by gravity. Okay, you are putting the patient upside down, so by gravity it is coming towards the mouth. Okay, and there are some rules and regulations for these postural drainage. Before eating, before breakfast time, usually they do this position for some time, and then they give percussion, vibrations, and all that. Sometimes we give bronchodilators through nebulization, and then the secretions, it will be easy, it is easily removed from the patient. Okay, so what are the things we have seen? First, you position the patient. Fowler's position is important. Breathing exercises, we saw incentive spirometry, we saw the medications which are used, and then hydration is very important. Then percussion, vibration, postural drainage is also very important. Okay, of course, this is a most important thing in the treatment, which is oxygen therapy. Okay, oxygen therapy in detail we will be seeing in the in our class. Okay, we will be seeing in the laboratory. You will touch and see what are the different oxygen delivering devices, and how are we supposed to use it, what are the precautions we should take, all that you will learn. Only little theoretical part I will teach you now. Okay, so when the patient's saturation, when we are checking pulse oximetry, when we are checking the saturation, when it is below 95, 95 to 100 is normal. Below 95 itself, these patients will be started on oxygen. Okay, maybe after surgery or some respiratory problems they have, or some bronchoconstriction, asthma is there, or COVID-19 problems are there. Okay, such patients will be started on oxygen therapy. Okay, and for the oxygen to be started, it's like a drug, so doctor's order should be there. We don't have some places there are standard orders, like after surgery, if you find the saturation is below 95, the nurse can start 5 liters of oxygen. So like that, some places there are standard orders, but most of the time we need to have doctor's order to start with the oxygen. And oxygen can be supplied as a portable cylinder. Okay, maybe the patient has to be moved to some place, or the patient is at home, so they can use cylinder or tank, but most of the time you will find in the hospital setting it is the wall outlets. Okay, we have it for a central supply for the whole hospital, and through the pipes it comes to the wall, and we just have to use those systems. Okay, and we need to use always something called, you see in the small picture, this is called humidifier. This is always filled with water, and the air which the oxygen what we are giving should go through this humidifier, so that oxygen can dries up your mucous membrane. To prevent that, we pass the air through the water, so that is called humidifier. Okay, and also another thing, this part is called flow meter, so we can adjust the flow of oxygen, how many liters we need to give, all those things can be adjusted. These are the different ways of delivering oxygen. The commonest one is the oxygen cannula. It starts with very less amount of oxygen also can be given, then simple mask, maybe little more, and then we have partial rebreather, non-rebreather, and venturi mask. All these 5 we have got in the laboratory. We will show you, then you can understand better. Okay, what is this oxygen cannula? As I said, cannula, you can see it is only a two small tubes which are fixed inside your nose, so the patient can talk, patient can eat, and it is only very little amount of 2 to 6 liters only can be given. Okay, what is the problem? Because continuously we are keeping it in the nose, the mucous membrane can get dried up, because you uh, continuously the high concentration of oxygen, continuously the oxygen is going on, so this can cause problem. Now the cannula itself, we have some high flow cannulas, okay, which is designed mainly for COVID-19 patients, and many of these patients are put on that. So again, as I said, dryness is the problem, mucous membrane can get ulcerated, there can be some bleeding sometimes. Okay, these are all the problems with cannula. And then simple mask. Simple mask is actually very good for us to give 5 to 8 liters of oxygen. But the only, see, do you see the small holes on the sides also? So patient also takes air from the atmosphere, plus oxygen is also given. The problem is, whenever they want to eat or talk, they have to remove it, then only they can do that. Okay, that is the problem with this. Then there is something called partial rebreather. Okay, you will find a mask where there is a small bag also which is there. Okay, in between this mask and the bag there is a valve. Okay, so when the patient is breathing, some of his air, exhaled air, okay, goes inside this area, this bag. So again, when the patient is taking the breath, next breath, the exhaled air of the patient also goes in. Okay, so oxygen is going through a tube, but at the same time, the patient's exhaled air from the bag also goes to the patient. Okay, so this is partial rebreather mask. Again, high percentage of oxygen is given. When we show it in the lab, I think you will be able to understand it better. Then non-rebreather mask. Here you are not allowing the patient's exhaled air to come to the patient at all. So what do we do? There is a one-way valve here. What are they doing? The one-way valve allows only, see, this is filled with oxygen all the time. So when patient is getting oxygen, when he or she is inhaling oxygen, the oxygen which is there in the bag also is sent. See, very high percentage of oxygen is supplied through this method. 95 to 100 percentage of oxygen, 10 to 15 liters of oxygen can be delivered at the same time. This is another common one. Okay, see your this COVID patients example. Okay, COVID patients are put on ventilators in the ICU. Now you are seeing that his saturation is improving, his arterial blood gas levels are becoming better. So slowly you want to reduce the oxygen which is given to the patient. So we have different colors of these Venturi masks. We will show it in the lab. We have green, red, blue and yellow, white. Okay, each one different amount of oxygen will be passed through. So you see this small color, this is yellow in color. So we have different colors. So what do? We start with 50% or 60%. Then once the patient is maintaining that, bring it down to lesser, and then remove the oxygen. So it is step by step. Venturi masks are used to reduce the oxygen need of the patient little by little, okay, as they are progressing. And these are all, this table is very important just to know that how much we are giving through cannula, mask, partial rebreather, non-rebreather, then Venturi mask, and then there is something called phase tent which are used for children. When you go to pediatrics, you will learn about it in detail. Okay. Okay, there is a question for you. A nurse is caring for a patient with chronic lung disease who is receiving oxygen through nasal cannula. What nursing action is performed correctly? Please read through everything and then tell me the answer. Okay, when we are giving oxygen therapy, some of the precautions which are very important, we always put a board saying that no smoking. We know patients do not smoke in the hospital setting, but some relative who's staying with them or someone by mistake, if they see oxygen, supports combustion. Oxygen can help in burning. Okay, that is the meaning of supports combustion. So we need to put no smoking board. Oxygen in use should be put on the client's door or the entrance of the room, and we should tell about the patient and also instructor the visitors about the hazard of smoking when oxygen is in use. And then there are some materials like woolen blankets and synthetic fabrics can has static electricity, so even that can cause sometimes fire. And another important thing is the electrical fittings, whatever is there in the wall, because the oxygen is also coming from the wall outlet. There should not be any leakage of electricity or any small spark of fire also. If it is there, this can cause problem. Actually, in the hospital, Sultan Qaboos hospital, earlier there was a fire because of oxygen, but by God's grace, no patient was injured. Okay, they were all saved. So we have to be very careful when we are administering oxygen. And the last thing, always show where is the fire extinguisher, so that in case of a fire, where they should reach, how they should do it, and all that should be known to the healthcare personnel. Okay, then there are some things called when patients are becoming very sick. Okay, when oxygen cannot improve their saturation, the next step is artificial airways are used. The patients who are very unconscious, we use the first one, which is called oropharyngeal or nasopharyngeal. This is actually uh, the tongue. Many of these unconscious patients, the tongue rolls back and it is obstructing the airway. In such cases, their tongue is brought back to normal position, and then we put this airway inside that. It's a polyvinyl chloride, PVC material like a plastic, and it is inserted inside. Okay, I think you would have heard about ambu bag. During CPR also we use it. This is just for temporarily till you connect the patient to the ventilators. Okay, ventilators are the machines which functions like a lungs for a person. So when they cannot breathe by themselves, they are connected to the ventilators. Till you put the patients on ventilators, we are giving, see how they are holding the mouthpiece, and then when you press this bag, it's like inhaling and pushing air inside the lungs. Then the next step is when you want to connect the patient to the ventilator, how do you connect them? Okay, the machines. You have to insert something called endotracheal. Endo means inside, trachea you know. So inside the trachea we need to put these tubes, and this tube is connected to the ventilator, and the ventilator will breathe for the person. Okay. And all these patients who are having a lot of secretions, if they are conscious, okay. If they are unconscious, like in oral care we learnt about oral suctioning, isn't it? Because they are unconscious. So same thing, we can do nasal suctioning, oral suctioning, and once in 2 hours or 4 hours we need to remove the secretions which are built up in the trachea or in the mouth. Okay. And some of these things you should remember. Oxygen, always when the order of oxygen is always in liter flow rate. Okay, liter per minute or percentage of oxygen. They write it like 4 liters per minute or give 24% of oxygen. The order will be like this. Okay, and we need to always check ABG values. If they are patients who are very sick, who are there in ICU, continuously arterial blood gases, mainly for oxygen, and PaCO2 is carbon dioxide. Okay, the normal levels are these. So they keep checking that. Based on that only increasing the oxygen or reducing the oxygen will be done. And also we have to be very careful if the patient has COPD. COPD means chronic obstructive pulmonary disease. If they have some disease like that, they should not be given high concentration of oxygen. We have to be careful to give lesser amount of oxygen, because they need some amount of carbon dioxide also. If you give more oxygen, the carbon dioxide level of the body is reducing. Why carbon dioxide is very important? Because it is a stimulant. Okay, where is the respiratory center? I'm sure you all know it is there in the medulla oblongata and pons, isn't it? So for those areas to be stimulated, we need some amount of carbon dioxide also in your body. In COPD patients, they have less amount of carbon dioxide when you give more oxygen. So they go to sleep. They don't breathe by themselves at all. We need to be careful when we are administering oxygen to COPD patients. Okay, and in the ward setup, we have to be continuously checking SpO2 to know that whether it is between 95 to 100. If it is reducing, we need to increase the level of oxygen administration. Okay, other assessments we should continue. How is the skin, mucous membrane? As I said, it can become pale in the beginning, then it can become bluish in discoloration. That is called cyanosis. And how is their breathing pattern? You know, tachypnea, bradypnea, orthopnea, dyspnea. So check for all those things. And lung sounds. Okay, we will show you in the laboratory how we are going to check the lung sounds. You can hear some abnormal sounds, then you need to report it. Okay, then presence of clinical signs of hypoxemia. Hypoxemia, as I said, less amount of oxygen in the blood. So the patient will have tachycardia, tachypnea, restlessness, dyspnea, cyanosis. Cyanosis is bluish discoloration. They'll be confused, and you have to check for all these things. Okay, tachycardia and tachypnea will be the early signs. The patient is trying, the body is trying to compensate. But if it is still continuing, you will see the patients becoming confused because the brain cells are not getting adequate oxygen. These are the late signs. Okay, so after we give oxygen or doing all these nursing care, you should see that the patient's respiration has become unlabored and the normal rate is there, and they are comfortable. Okay, this will be the expected outcome of the patient. Okay, so we have learned about how is normal oxygenation mechanism and what are some of the difficulties they can have in each of those 4 areas, and what are all the nursing measures we can do, concentrating more on oxygen administration, which we will be practicing it in the lab. Okay, thank you. If you have any questions or doubts, you can send me email or ask me in WhatsApp. Okay, thank you.